Have you ever sat in a doctor's office and just wondered about the huge, invisible system that had to exist just to make that one appointment happen? Well, that's exactly what we're going to unpack in this explainer. We're following the thread from a single checkup all the way to the global goals that shape all of our health. Okay, let's get into it. It sounds like a pretty straightforward question, doesn't it? But the answer is so much deeper than you'd think. What makes healthcare really work isn't just about amazing doctors or fancy new machines. It's about a core philosophy, about how we as a global community have decided to take care of each other. So let's start where it all begins for us, with the individual, with you and the care you receive. When we boil it all down, what exactly is healthcare? Now, the really important thing to notice here is just how broad this definition is. It's not just about fixing things when they break. It's this whole spectrum of services, right? Stuff designed to actively promote well-being, to maintain the good health you have, to monitor for any changes, and yeah, to restore your health when you get sick. And that leads us to a super important distinction. We tend to use the words healthcare and medical care like they're the same thing, but they're really not. Think of it this way. Medical care, that one-on-one service you get from a doctor, is just one piece of a much, much bigger puzzle. Healthcare is the entire ecosystem. So what's the difference between just having services and having quality services? Well, it comes down to these 7 things. I mean, think about it. Care doesn't do you much good if it's not actually available when you need it, or if you can't get to it. And it's totally useless if you can't afford it. For healthcare to truly work, it has to hit all these marks for everyone. Okay, we've looked at the individual services. Now let's zoom out and look at the incredible machinery that actually delivers all of it, the health system itself. This is the big one. The health system is the whole shebang. It's the people, the buildings, the funding, the rules, the technology, all of it, organized for one purpose. It's the how behind the what of healthcare. And that system is usually structured in a pretty logical way with 3 main levels. You almost always start at the first step. Primary care, your local doctor for everyday stuff. If you need something more specific, you get referred up to secondary care. And for the really complex, advanced treatments, you move to the very top, to tertiary care. All right, time for our final zoom out. Because your local clinic and even your country's health policies don't exist in a vacuum. They're all deeply connected to decades of global conversations, big ideas, and worldwide goals. Let's see how we got here. You know, in the late 1900s, a few key events completely changed how we think about health. In '77, the world set this incredibly bold goal of health for all. Just a year later, the Alma-Ata Conference gave us the strategy, primary health care. And then in '86, the Ottawa Charter shifted our focus from just treating sickness to actively promoting wellness. These were absolutely revolutionary ideas. And this quote from that Alma-Ata Declaration, wow, it just captures the spirit perfectly. The keywords here, universally accessible and full participation. This was radical. It wasn't about experts telling communities what to do. It was about putting the power of health directly into the hands of the people. And here's the most important part. This approach was incredibly holistic. It understood that health isn't just about not being sick. It's about the fundamental building blocks of a good life: education, clean water, good food, immunizations, all of it. This holistic thinking became a blueprint. It directly inspired the world's first huge, coordinated effort to tackle global problems at the start of the new millennium, the Millennium Development Goals, or the MDGs. So for 15 years, from 2000 to 2015, the entire world focused on these 8 big goals. And you can see that health was right at the heart of it, with specific targets to reduce child mortality, improve maternal health, and fight huge diseases like HIV and malaria. But the work didn't just end in 2015. The global community took all the lessons from the MDGs and created an even bigger, even more ambitious framework for our time, the Sustainable Development Goals. And this evolution is really the key. The new agenda, the SDGs, is universal. That means it applies to every single country, not just developing ones. And its scope is way, way bigger, recognizing that health is tied to everything: the economy, society, and the environment. This was a monumental leap forward. And right there, as goal number 3, we have it, the modern mission statement for global health: ensure healthy lives and promote well-being for all at all ages. It's powerful, it's ambitious,
And it pretty much sums up this entire journey.
And if you really want to understand the sheer scale of this ambition, just look at this number. There aren't just 17 goals. Behind those goals are 169 specific, measurable targets. The size of this global project is just immense. And that brings us full circle, from the global right back to the personal. We've gone from a single doctor's office to a planet-wide agenda. The goals are set, the plans are in place, so the real question now is, what part are we all going to play in making it happen?